Thank you very much, Senator Blumenthal. Thank you to Senator Van Hollen for bringing us together today. Every single day, Donald Trump is working to destroy the American healthcare system as political retribution against Democrats for opposing his plan to strip healthcare away from 24 million people, and as leverage to try to push through an American Healthcare Act that everybody in this country hates. This has been systematic, this has been planned, and this has been intentional. It started with the executive action, which, unlike other executive actions, wasn't just about the rhetoric, because a month later, the IRS acted on the executive order. The IRS announced that it was no longer going to enforce the individual mandate clause of the Affordable Care Act, which Senator Van Hollen mentioned has led to rate increases all across the country. It continued with the ending of advertisement for the healthcare exchanges. The former advertising director for healthcare.gov said that almost 500,000 people didn't sign up for exchanges because the advertising was pulled and because Trump, upon inauguration, telegraphed to everyone that if they signed up, their health care would be at risk, which was a lie, which was a falsehood. The exchanges were experiencing record sign-up rates before Trump was inaugurated. Enrollment fell off a cliff after the inauguration, when the executive order was signed and when the marketing was pulled. So to the extent that insurance companies are thinking about increasing rates or rethinking their participation in the markets, the sole cause of that harm to consumers is Trump's effort to undermine and sabotage the Affordable Care Act. And his tactic likely won't work. Chances are still just as good as not that a health care bill does not pass the House and the Senate. I mean, the American public hates the American Health Care Act with an intensity that we have not seen in this country in a long, long time. And so there is a good chance that this whole effort to repeal the Affordable Care Act will crater, will ultimately be unsuccessful. The Affordable Care Act will remain, but it will be much weaker because of all of these efforts that the Trump administration has taken. So this week, clearly, people's focus is on the FBI and the special investigator. To the extent people are focused on healthcare, everyone's wondering about what these Republicans are writing in secret behind closed doors. But we're here because we want people to be paying attention to what is happening right now. Right now, the Trump administration is pulling the rug out from under the American healthcare system, rooting for its failure, and ultimately becoming responsible for any diminution of quality in the system. And one last piece before we take some questions. The other way that they're undermining this act is through the cost-sharing reduction payments. The administration has made it very clear that at any moment they may stop paying the insurance companies the subsidies they need in order to remain on the exchange. They have committed to paying through May, but they have not committed to paying through the summer or through the fall. If you're an insurance company, how on earth do you price a product if the individual mandate isn't being enforced, if HHS is refusing to make a commitment on paying the subsidies, and there's no participation in the marketing campaign from the federal government? Any uncertainty that exists in these exchanges is due in whole to the actions of this administration, and we wanted to shed some light on that today.
Thank you.